Okay. Well, hello everyone, and welcome to our third session of our Project Echo model sessions. Today we will be discussing motivational interviewing for nutrition and physical activity. And then again, welcome everybody, and thank you so much for joining us again. So here we have just some reminders as always to please keep your line muted if you're not planning to engage in the with our participants. Please make sure that you also engage in the chat if you have any questions or would like to share any information with us. Please raise your hand if you would like your line to be unmuted. This session is also being recorded. The slides are also already available in the iEcho program platform. And the recording link will be sent to you all via email soon. And also let us know your information. Let us know your name, your organization, your title, and what brings you here today. So, good morning, Adriana. Thank you so much for joining. And then again, the contents of this session today are 100% financed by the Health Resources and Services Administration and do not necessarily represent the official views of HRSA, HHS, or the U.S. government. And NCHPH's mission is to strengthen the capacity of fairly funded health centers and other health center grantees by providing training and technical assistance. Again, just to reintroduce myself, Frida Pineda Sandoval, and if you're also joining us for the first time, my name is Frida Pineda Sandoval, and I am the TTA manager here at NCHPH. And with me, I have my colleague, Olajumoke Oladipo. She is our health communications and research analyst, and she will be the one mostly engaging in the chat and helping us with the logistics of today's session. And with us, we have a very special guest, Dr. Jose Leon. He's our Chief Medical Officer, and he will be providing most of the content for today's session. Now, without further ado, I'll pass it on to Dr. Jose Leon to get us started with the information.
Thank you, Fidel. Hello, everyone. Such a great pleasure to be with you again. This is our third session, our third echo-like session on nutrition and strategies that we've been discussing for the last few weeks. Just a first a brief recap. We went over some of the nutrition concepts. We reviewed some challenges. We provided some tools, and we went over some of the issues that doctors and clinicians encounter when they have conversation with the patients about obesity. We also provided some information about the challenges that patients have to follow the doctor's instructions. So at this time, we are going to have a brief conversation on another tool that we can use when we have conversations about nutrition and exercise with our patients, specifically how to or how we can motivate our patients. It's really interesting to see data about some patients' experience, and even though around 90% of patients say they are very satisfied when they go and visit a primary care provider, only 52 to 64% say that they have received the information that they need or the information that they are willing or expecting to get from the clinician. So it's really important how we communicate with our patients, the type of conversations that we have. And because obesity and nutrition and exercise are really tied in how we speak with our patients, regardless of any strategy that we can follow, any diet, any recipe, or any evidence-based practice. The conversation that we have with our patients is very important to motivate them, and they feel that they are achieving or they are setting some goals and achieving those goals. Next slide, please. So let's get started, and we have a brief case study here. Please, since this is an interactive activity, please make sure that you try to interact with us. Either you can use the chat, or you can uh, speak verbal or participate verbally. Your line can be unmuted. But we are going to talk about a 45-year-old patient who is obese and is experiencing a knee pain and reporting high stress levels. During a routine checkup for high blood pressure, the doctor briefly notes the patient's BMI and states that her health issues are due to her weight and advises her to lose weight, eat less, and exercise more. Next slide, please. So we have 3 points here for discussion. First, what are the elements of poor weight management advice? In this case, our patient received details that she was overweight, that the reason why she had a knee pain is because she is obese, and that she needs to lose weight and exercise. So what went wrong with these instructions? The instructions are clear, concise, but what was wrong with this conversation? If you can chime in and let us know what you think about this brief conversation that the doctor had with the patient. And you can also say, just to save some time, what would you do different here? And how would you approach this conversation if you have a patient that you are having, or you are going to provide some recommendations and instructions? What would you do that is different? And third, how would you use open-ended questions here and reflective listening with your patients? So let's try to respond to what went wrong, what would you do different, and what type of strategies you would use to have a conversation with your patient. Thank you, Lisa. Lisa is saying that it seemed stigma-based. She says that she would ask questions like, what does a typical day look like in regards to meals and activities? That's excellent, Lisa. Is really important to know specifically what, I mean, the patient is there for us for a different reason. The patient was not coming to the clinic because of her weight. She was coming for another health condition. So we need to make sure that we are asking those questions, making sure that we address the issue that or the reason why the patient is coming to the office. And second, in the very first session, we discussed that the first thing that we note is our patient's appearance and how she looks like, whether or not she looks sick or healthy, or if she is overweight. So if there is an other reason that you have to start a new conversation about a new topic with your patient, then this is the right opportunity. Adriana says, type of job and walk through a way to open the discussion on how the patient can improve eating and physical habits and activities. That's great. That is excellent as well, Adriana. The other thing is, we cannot just talk to a patient and let her, in this case, let the patient know that she needs to lose weight if we do not offer any other alternatives to our patient. If you are in a clinical setting and you have nutritionists or you have an exercise program, this is the opportunity to refer the patient to any of the other divisions that you have, so the patient feels that she is being, or she's receiving the care that she deserves. So thank you so much, Elisa and Adriana, for participating. Next slide, please. So we are going to talk for the next few minutes about motivational interviewing. And when we are going to have a conversation with our patients, first, the change needs to come from our patient. We are not supposed to change, or we are not supposed to tell the patient what to do. We need to find ways so the patient understands the need to actually change. And this is what we call behavioral health interventions, making sure that the patient understands, and based on the conversation that we have with our patients, the patient accepts and decides to change any habit or anything else, or anything that you would like the patients to follow, if you are giving the patients some instructions. But in order to do that, we need to understand that each patient and everyone is different, that this is going to be a learning process, that this is not going to happen in the first visit, but we need to have an opportunity to talk to our patients, and making sure that the patient understands the reason why he or she needs to change any habit or anything that the patient or you are discussing with the patient. And remember, each patient will have, like in this picture, ambivalence. Make The patient is going to have pros and cons. Sometimes the patient is going to say, yes, I want to lose weight, but I have the family history. Everyone in my family is obese. Or, yes, I know that I need to exercise, but I don't have time. So we need to accept that. Based on the conversation, we can find ways to elicit change in our patients. Next slide, please. So remember that patients need to understand that in order to make changes, we will have to make sure that we forget some of the habits, or change some of the old habits that we have. And we need to make sure that when we have a conversation with our patients, the patient understands that what is the motivation for change, why the patient needs to change a behavior. We can uh, help the patients so they can understand that the a change is better than the status where the patient is on at this moment. It is not something easy to tell a patient that you have to do this without the patient finding a real motivation to do it. And the patient needs to understand and need to believe that a change is possible. And you can do, I mean, this sounds like a really long talk that you can have with your patient, but in reality, just by making sure that you're actively listening to your patient and finding the opportunity to guide the person to that motivation is the key to help the patients, and not only in nutrition or obesity, but in any change that you want the patient to go, or any opportunity that the patient will have to make changes. The main key is to listen to our patients, and when they open the door to and you see the opportunity, you can tap into that opportunity and have a conversation with your patient. Next slide, please. Remember, the idea here and the main goal is that we are not making any changes, that we don't want the patient to follow our instructions or our advice. is that the patient finds how how he or she can change, and our goal is just to guide the patient. We are not making the changes. We are not suggesting any changes to the patient. We are just helping the patient to find um, a goal, or an ideal, or something that can help the patient to change. Next slide, please. So we are talking to a patient, and we are starting a conversation, and let's say that the patient, you see that the patient's BMI is 30. So you can say, okay, my patient is obese, and the first thing that you have to do is to ask permission. Is instead of just saying you need to lose weight, we can we can start a conversation about, I would like to talk to you about your nutrition habits, and your weight. Is that something that you are interested in, or can we talk about this? There is an opportunity for you to if you have a patient with diabetes or with other chronic condition, you can say, may I talk to you about this, or about your diabetes or your hypertension? So, and making sure that you understand the relation between diabetes and obesity, for instance. And we need to use open-ended question. We are going to go over some open-ended questions, but we need to give the patient the opportunity to talk. We don't, in this case, we don't need a yes or no response. We need that a patient feels the opportunity to talk and discuss with you the issues, the challenges, and the opportunities for to elicit some change. And in reality, you can help your patients if you listen. If you listen, and you make sure that when the patient is talking, you are summarizing that what the patient is saying, and then make sure that if there is some resistance from your patient, you don't have to push the patient. You will find other opportunities. You will have other ways to make sure that the patient understands what you are trying to say, the goals that you are expecting the patient to achieve. But make sure that this that you are not going to change. Make sure that you understand that also that you are not going to change the patient in just one conversation that you are having. Next slide, please. So the first aspect that we discussed is to ask permission, making sure that the patient that the patient feels that you are not going or invading their space. You are asked. There are a couple of examples here. For instance, do you mind if we discuss your weight today? Or can I tell you what concerns me about your weight? Or is it okay to talk about the possibility of losing some weight? So here you are asking the patient, so the patient can open, and you don't find some type of resistance for the patient if you just say, hey, you need to lose weight and you need to exercise more. Next slide, please. Then we need to ask open-ended questions. And these are questions by definition that do not invite short one-word answers. We don't want to hear from our patient yes, no, or maybe. We want to hear the patient, the ideas, the challenges, the concerns, and the goals. So how can we ask those questions? Next slide, please. So basically, the open-ended questions are what, how, uh, or may, if you are asking, right? And we try to stay away from why. And Does anybody know why we should not be using why? I mean, it's repetitive, but what is wrong with asking why to our patients? Anyone in the chat can tell us why or what is wrong with asking why? Yes, Kelly, it places blame, and you will find judging correct, and the patient will not participate with you, or will create like a barrier, between the doctor and the patient because you are asking why, you are judging the patient. Thank you, Adriana. Next slide, please. So when you receive a negative response from your patient and the patient is reluctant, sometimes the conversation that we have with patients is like, in my family, we are all obese. Why should I lose weight? Or I like eating. I like having desserts. Or in my culture, we have this type of food, and it's going to be difficult for me to live. So not eat do not eat this food. So if the patient is reluctant, the question is, what would have to happen to you for you to consider this? Is let's restructure the question, right? And if you receive a negative response, even though you are not trying to have or to change or to make changes to your patient from the very beginning, you can also have a second question about what do you need or why would you have to, or in addition to this, it's difficult for you to lose weight, and or it's difficult for you to exercise, and what motivation would you need to start exercising, or how would you start this new journey? So that you have to reassess. You have to ask the question in a different way in order for you to elicit a response from your patient. Next slide, please. Next slide. Well, we'll go over the importance ruler, and this is a really good tool that we can use. Next slide. So we can use these like a brief question, a measure from 0 to 10. We can ask the patient from 0 to 10. How important would you say if it is for you to lose weight, or how important is for you to lose weight? So we can measure, whether or not the patient is at the earliest stages of some changes, or if you have to wait and have a different approach when you're having this conversation with your patient. But it is important that sometimes we provide the tools to our patients in a scale on a scale from 0 to 10, on a scale from 0 to 5, so that you have a better understanding of where you are and where the patient is in order to elicit some changes. Next slide, please. Next slide. The other way is the confidence. We need to ask our patient about if you decided to lose weight, how confident are you that you could do it? So this is going to give you a better understanding on first whether or not the patient wants to change, and second whether the patient is confident that the patient can achieve some of the goals that you and that you and the patient will have after agreeing on losing weight, on eating better, or exercising. But you need to make sure that first you understand whether or not there is the need for the patient to change, and then how confident the patient is to achieve the goals if the patient decides to change. Next slide, please. And when a patient is, when you're having also conversation with patients, you need to make sure that you boost confidence, that you are having a conversation. If you're having a conversation with your patient, it's not only about the issue that you are discussing. You can bring into the conversation another activities or another goals that the patient has achieved in the past, whether the patient is a patient who has some type of education or degree, and or the patient is a parent and is a proud a parent of a kid who is doing really well in a school. So all those things can bring, the opportunity for you and the patient to have that confidence that you will need to elicit changes in your patient. So you can ask the patient to write some goals. You can ask the patient what is the best thing that they have done and how they did it, so the patient can find that if in the past he or she was able to make some changes, now that is with you and you are setting some goal with the patient, he is also or she's also able to make those changes as well. Next slide, please. This is, in my opinion, the most important part of any conversation with our patients, and we need to listen and make sure that we react based on what we hear from our patients. Sometimes the primary care settings are very busy. You have other responsibilities. You have more patients to see. You have to go to a meeting, or you have to attend a call, or you have any other tasks. We are not paying enough attention to our patients, and in reality, what we have to do is just to go over what the patient said and just rephrase what the patient says, so the patient feels that what that patient is saying is being listened by the person who is taking care of his or her health. Yeah. So it's really important to just repeat what you hear, making sure that the patient feels um, that the conversation is going to a place where you can find an agreement with the patient, and making sure that you address the challenges and the issues that a patient can have when you're having this type of conversations with them. Next slide, please. These are other examples. For instance, if a patient says, "I cannot lose weight. I have two jobs, a full-time job, and I have a part-time. Uh, I don't have time to cook. I eat whatever I can find while I'm moving from one job to another one. Um, I there are you better than anybody know exactly what the challenges of your patients. So you can ask the patient, can you help me understand why I fully understand that you have two jobs, that you have little time to do this, but can you help me understand why you cannot cook over the weekend, for instance? Or why is so difficult for you to find healthy foods while you are moving from a place to another one? So what we have to do is just to rephrase the patient and elicit that conversation, so the patient can understand that there are other ways, that they are like moving like in a straight line, but there are other ways to go to the same place if you stop for a moment and rethink, what you need to do different. So this is again the type of conversation that we can have with patients. It shouldn't take long. I would say that if we are doing and we start doing this exercise, it can take 5 minutes or 10 minutes just to get an agreement with a patient. But we need to listen to our patients and making sure that we ask the right questions so we can set goals with our patients. And our patients is the one who is going to say, this is what I want to do. By the end of the month, by the end of this period, I am planning to do this. That is the best strategy, but in order to do that, we need to listen to our patients, and I will underline and highlight that we need to listen to our patients. Next slide, please. Now, remember, everyone has internal conflicts for different reasons. Um, Patient wants to make a change, but at the same time, the old way is something that they are used to and they don't want to change. But at the same time, they say, okay, I want to exercise, but at this, but there is a really nice basketball game, and I have this whether I watch the game or I go to an exercise, or if I need to or if I need to take care of the kids, or if or I exercise, for instance, and then there is that conflict. So the patient needs to find ways, having the conversation with you about why, for instance, why. I mean, is it possible for a patient to do both? I mean, if you have kids and you are taking care of the kids, we understand that, but I mean, you can go to a park and play with the kids, and then you will be doing both. You will be exercising, you will be taking care of the kids. But that's something that the patient needs to find. Again, we are not the ones providing the solutions. We are the ones hearing, listening to the patients and making sure that they find, a solution to their challenges. Next slide, please. So another good resource is when you're having a conversation with your patients and the patient has that internal conflict. You can ask the patient, next time when we have a conversation about this topic, try to bring this or try to write down, whether if you want to lose weight, what are the pros and cons? And if you don't want to lose, I don't know, if you don't lose weight, what are the pros and cons? This is very helpful for patients because they can see what the challenges are, how confident they will be to address those challenges, and at the same time, what are going to be the consequences or the complications if they don't have any changes or any uh, solution to the issues that they are facing. So I have found this very useful to have when you have a conversation with your patient is okay, let's see at the pros and cons. Let's talk, or let me know, if you don't lose weight, what are going to be the consequences, or if there is any pros, or same if you are losing weight. So this is very helpful when you are having this conversation with your patients, or when you are having a future conversation with the patient. Next slide, please. So there is a strategy here, in motivational interviewing is the ORS, which is open-ended questions, affirmations, reflections, and summaries. If you follow these, you can finalize a conversation with your patients in less than 5 minutes. Then you have to Remember the ORs. So the open-ended questions, the affirmations, you need to recognize the patient's strength and the reflections, and then, okay, we have agreed or you have said this, is that you are going to do this. Lisa says, I love the idea of using their words back to them. It shows we are really listening to them. That's exactly right, Lisa. I mean, these strategies are used, by psychologists and psychiatrists, and there is a lot of evidence based behind all these strategies. So it's very useful, and you will see, that you can elicit changes and you can see changes in your patient, because you can have the best diet for your patient and you can set some goals like next week we are going to talk about exercise and what the recommendations are depending on the age of the patient, of the ability of the skills of the patient. But in reality, if there is no motivation, if the patient doesn't find the reason why they need to change, it's going to be difficult for them to achieve any goals that you and your patient are trying to set, for the benefit of your patients. Next slide, please. Okay, let's do some knowledge check. Let's wait here for a minute, and then we have a couple of questions. Please use the chat again, or if you would like to answer verbally, let me know. But our first question is, when a patient says, I know I should lose weight, but I just don't have the motivation, what is the best initial MI or motivational interviewing response? A, you need to start exercising at least 3 times a week. B, why don't you feel motivated? C, what are some reasons you might want to change? And D, you should try a structured diet plan. Kelly says C. Anybody else? Lisa is saying B. Adriana is saying C. Thank you. Here, the best, I think that these B and C are very similar, but just we went over why, or the use of the why, as an open-ended question, because the patient can feel that we are judging the patient, so it's better the what, the how, just to start this conversation with our patients. Next slide. Which of the following is an example of change talk? Can you go back to the first? Thank you. I've tried everything and nothing works. B, I don't think I can give up fast food. C, I will feel better if I had more energy. D, this is just how my body is. Which of the following is an example that you can use? Yes. The answer for this one is C. And again, this is the opportunity that you have, in order to elicit change in your patients. Next slide. No, other two questions. Patient says, just tell me what to do and I'll do it. What is the most appropriate motivational interview and consistent response? A, follow this exact meal plan. B, you should cut out all sugars. I can share some options, but I would like to hear what has worked for you before. And D, you need to be more disciplined. Again, the answer is C. And remember that we have just a slide where we're saying that we need to understand what goals the patients have had in the past, and we can use those as a motivation, saying, if you were able to do that, then this is going to be easier for you. If you have already done that, and you have the power or the willpower to do it, this is going to be something easier for you. So it is, the answer for that question is C. Now, next question. Which technique best reflects reflective listening? A, you need to lose weight for your health. B, it sounds like you feel frustrated with past attempts to lose weight. C, have you tried counting calories? And D, you should join a gym. Yeah, yeah, that is the right answer. The right answer is B. Next slide, please. What is the main goal of motivational interviewing in obesity care? A, to persuade the patient to follow medical advice. B, to provide a strict weight loss plan. C, to elicit the patient's own motivation and support behavior change. Or D, to focus only on calorie reduction. Yes, the answer for this one is C, and that is the definition of motivational interviewing. We are trying to elicit a change or some change in our patients. And the last question of this knowledge check is, which response supports patient autonomy? You must stop eating junk food. The best way is to follow my plan exactly. C is your decision, and I am here to support you in what feels right for you. And D is, if you don't change, your health will get worse. And the answer is also C. And we need to make sure that the change is not coming from us. It's not that we are saying the patient what to do, but the patient needs to understand the reason why there has to be a change in their life. Next slide, please. So just to recap, remember that when you are having a conversation with your patient, first you need to know, you need to let the patient know why you are discussing this. You need to share the agenda, say, so we are here today because I've heard that you would like to lose some weight. I'm here to help you. And that is going to be, in that, in sharing the agenda, you will be raising the issue, which in this case is going to be either improve the nutrition habits or lose weight or exercising. And then we have to cultivate change, build on what you hear. The ask, tell, and ask is really good. Thank you, Lisa, for joining us. Thank you so much for being with us today. So all this is really important, and make sure that when you have finalized, the conversations with your patient, you recap. You make sure that you have the idea of the problem, the challenges, and the potential solutions to the problem. Next slide, please. Remember that there are 4 steps when you're having motivational interviewing. First, you need to engage with your patient. You need to have this conversation. You have to be very honest about what the goal is and why you are doing it. You need to hear or listen to your patient. You have to focus on the issue. And then you need to find solutions and find a plan for your patient. Next slide, please. The next slides are just some examples that you can go over because otherwise it would take too long to read out loud this. But this is a conversation, and this is coming from the American Academy of Family Practitioners. You see the link, and you can find this whole conversation on how you can engage with your patients and follow the steps, during motivational interviewing. But the example, if you see the left column, is providing exactly the same tips that we've been discussing, like ask an open-ended questions with or without time specification. Next slide. if you continue reading, the conversation, you see that the patient expresses the concern, and then you assess, and then you summarize because you have listened to your patient. So this is honestly one of the best resources that I found. You can see an example of how it can go, a conversation with your patients, and the time that it takes for you to have a very brief conversation with your patients, about any issues that you would like to discuss. Next slide, please. The same concerns. You will see the physician talking and repeating what the patient has said, and you see Ms. Jones providing additional information. And so again, is really good, resource, and is coming from a notable organization. This is something that the American Academy put together. I If you are interested in how to have a conversation with your patient, I encourage you to take a look at this conversation between this physician and Miss Jones. Next slide, please. And then you are coming to an agreement with your patients. You are summarizing, based on what we have said. Next slide, please. And then there are some tips on how you can be respectful and express empathy to the patient, making sure that you are listening, making sure that you are repeating what the patient is saying, and making sure that the patient is the one finding some ways or some opportunities to change. Next slide, please. And then you have to summarize, as I said, and finally you have to acknowledge, the enthusiasm that the patient is expressing. That's another good tip, to say, I am very happy to hear from you that you are going to do this in order to lose weight, or you are going to start exercising because at the end you want to spend more time with your kids, or you are going to try to eat healthy because that's going to be the opportunity for you to bring down your A1C. So you have to acknowledge, the effort and the enthusiasm that the patient will be providing. Next slide, please. And also, a part of the conversation is to get feedback. Is really important, and with this strategy, the ask, on to get feedback from from your patient. In this case, you ask a question, the patient provides a response, and then if you have additional questions, you can make sure that the patient is providing different alternatives. If the patient is saying, for instance, I want to lose weight, doctor, my idea here is that by the end of, next time that I see you in 3 months or whatever, I will come here and I will lose this. And in addition to listening to the patient and saying, I am very happy to hear that you are trying, you can also, I mean, you need to provide the resources, that you have in place. I mean, if you have a dietitian, you can refer the dietitian, your patient to the dietitian. You can, if you have an exercise program, refer the patient to the exercise program. If the patient is diabetic and the patient is not in a diabetes prevention program or a self-management program, refer the patient. So provide additional resources to your patient so the patient feels motivated. Next slide, please. And it's, again, I mean, hearing, regardless of the strategies that you use, either the ORS or the ask, remember that at the end, you need to acknowledge, what the patient has said, and you need to say the patient that you are happy that the patient is motivated or that the patient is trying to achieve this goal, because that is going to be an opportunity for the patient to feel that what they have decided is the right decision for them. Next slide, please. And then remember to close the visit, and making sure that you have, if there is any gap in the conversation, if there's anything that the patient did not understand, or if the patient needs additional information, make sure that you address any of these concerns before the patient leaves the clinic or the health center in this case, because otherwise, what is going to happen is if the patient doesn't have all the pieces together, then the plan is not going to work. So make sure that every time that you finalize a conversation with your patient, the patient doesn't have any additional questions. Next slide, please. And then if possible, you need to develop, a plan. If it's a written plan, is much better. If the patient says, okay, I'm going to do this, this, and this, and the patient write that down, and it is so it's going to give, like it's going to give the patient a roadmap, to achieve, or to go to the place that they want to go. Next slide, please. And then again, I mean, this is regarding the SMART plan. And remember that we don't have to say, if you have a patient, the goals need to be achievable. We are not expecting a patient to lose 20 pounds in 2 weeks. If the patient says, no, by the end of this, next time that I see you in 3 months, my BMI will be, instead of 30, is going to be around 25. Let's make sure that we are smart and we set the achievable goals, so the patient doesn't get frustrated and the patient stop doing, or stop doing, or following the instructions that you have provided to your patients. Next slide, please. And again, I mean, if a patient has never exercised, for instance, and you are starting a plan for a patient, you are not expecting your patient to run to run a 20-mile race, right? I mean, you need to take into consideration the age of the patient, the whether or not the patient has exercised in the past, whether or not the patient has any chronic medical condition that is going to be a challenge. So you need to, even if your patient is willing, has all the enthusiasm to change, we need to make sure that we also don't, the patient don't overdo or try to overdo things. We need to bring them back, or a step back and say, okay, if since you have never exercised, since you have never done this, I want you to start just by walking slowly for 10 minutes. Then we can improve, until we get to the goal that we are trying to get. And in this case, I would recommend, or would refer you to our exercise programs specialist. He is the right person who is going to develop a plan with you. So those are things that are really important. Thank you, Kelly. Nice to see you. And thank you for coming. Next slide, please. And then just a case example, to close this conversation. And another patient, this is Jenny, a 55-year-old overweight patient with hypertension, hyperlipidemia, and knee arthritis, seeing you for a return visit. At last visit 6 months ago, you prescribed a beta blocker and a statin and suggested she start exercising. Today, she tells you that she has not been taking the meds because she feels fine. She says that she cannot exercise because she is too busy caring for her grandkids and because of her knee and back pain. She wants you to just fix it so she can be healthy again. So, the difficult case, patient is just here. I want you to help me with this. I don't need the meds. What I need is just fix my knee pain, and you know that that you the patient, in addition, to all this history that you need, the personal history that you need to get from your patient, whether or not there was a trauma in the past, whether or not this is related or not to her weight. How would you start a conversation with the patient? Next slide, please. So, is there any, in this case, let's focus on question number two. Do you recognize any motivational issue in the patient? So, Fide, we can go back to the slide, the previous slide. No, to the story. There we go. Thank you. Is there a motivational interviewing issue here? Something that you say, okay, the patient is saying this, and I want her, to help her in addition to address these issues, or the issue that she has. What is something that you can say, or how you can start this conversation with the patient? If you can use the chat box, let us know. But in the meantime, we need to acknowledge, everything that the patient is saying. We can say, I understand that you are busy, that you feel that the medications are, that you feel fine, that the you are not taking the medication, but I see that you are busy caring for her grandkids. And this, you can elicit a question is, um, you can ask, what you have done or what the grandkids have done in the past that you feel proud of, for instance, that is going to open a new door for the conversation. It's going to open, the patient is here because she wants you to fix the issue, but you need to open new doors, so the conversation is not like, okay, here's a prescription for your knee pain, and then you don't have a conversation with your patient about the other issues. So in this case, it's very important to make sure that you understand where is that soft spot, and from there you can start having a conversation with the patient. Next slide, please. So I'm next slide, please. I'm going to stop and see whether there is any questions. But remember, in the meantime, that we are not here to make anyone change. We are here to help the patients. We make sure that we understand that there is the patient can have pros and cons, and we need to listen to those. We need to make sure that is the patient who is going to find reasons to change, and the patient is the one who is going to choose when and how to change. We are just moderating and helping them to find those solutions. So, and the next, if you have any questions before we end this conversation, please let us know. If you would like to ask a question verbally as well, let us know. Next slide, please, Peter. These are really good references that you can use as well. The slides will be shared with all of you, so you can find additional information about motivational interviewing and how to talk to your patients. Next slide, please. Next slide. So please complete our post evaluation at the end of this webinar or echo session. You will find a survey. Let us know how we're doing. And if you have any additional questions, next slide, don't hesitate to contact our staff. For the next session, we are going to talk about physical activity and how we can find solutions for physical activity improvement. And next slide, you see our contact information, my contact information, Fides and Shimoke as well. So if you have any question, or if you, after this conversation, you say, hey, I forgot to ask this question, please don't hesitate to contact us. We are here and we are always happy to hear from all of you. Fide?
Yep. Thank you so much. Thanks everyone, and we'll see you during our next session. Goodbye.